So hello attendees, good afternoon everyone.
Yeah.
This side Dr. Bharti from 𝐕 and RadarOpus software team. So today we are having a webinar with Dr. Indraneel. So the topic of the webinar is Atherosclerosis with its homeopathic management. So let me introduce Dr. Indraneel here. Dr. Indraneel 𝐫𝐴𝐽𝐿 is a clinical homeopath. He has done his MD in homeopathy and he is practicing in Pune for 33 years. He has also done his LL.B and Diploma in forensic medicines and worked as a medico-legal advisor. Also, he runs his own YouTube channel. Up till now, he has presented more than 50 CMEs to practicing doctors and more than 3 papers on international forum he has given. He has written article on the Mongrel Sect in National Journal of Homeopathy in 2007. Aaron, he is attached to the kidney hospital named ACE Hospital in Pune as a homeopathic nephrologist. He is old user of RadarOpus, more than 15 years. In his practice, he is using the RadarOpus software that is sold by 𝐕. So now Dr. Indraneel 𝐫𝐴𝐽𝐿 is going to tell us about the atherosclerosis as well as its homeopathic management. So doctor, now you can start. I hand over to you. Now you can start the session.
Yes. So thank you, Dr. Agar, for your kind introduction. Actually, I welcome you all the attendees for the subject of atherosclerosis and homeopathy. In this time, my talk, in between, I will definitely appreciate if some of you respond in the chat by Q&A, because this is a common problem, atherosclerosis, which we face in day-to-day practice. Now, I think atherosclerosis is a word which we hear from our college days, our school days. School days means homeopathic school days, I mean. And every time in patients also we see it. But only we diagnose them as atherosclerosis. But what about the management, and what about the homeopathic management? Does conventional management is the only treatment? Shortly we'll go through it. Yeah, if I'm too fast, kindly let me know for that. Okay, I'm sharing my screen. Yeah, I hope you all can see. Just a minute. Yeah. So firstly, I thank the 𝐕 and RadarOpus team for inviting me here on this platform. They have given me an opportunity to be in front of you all for this talk on atherosclerosis. So I'm thankful from my heart for this opportunity. So friends, management of atherosclerosis with homeopathy. We are going to see today this thing. Like, may the power of natural healing bring health, harmony, and wellness to all, is a saying from Dr. Hahnemann. And we are proud to be homeopaths. And let us see how can we cater these things. Okay. Yeah, this is the introduction. Now, atherosclerosis. What is atherosclerosis? In short, I will tell you by words we will go. Narrowing of the arteries in human body. Actually, in animal bodies also it is there. We are talking about humans. So narrowing of the arteries, and this giving complications and causing disease to the human body. By scientific words, we'll say it is a specific type of hardening of the arteries where the plaque composed of fat and cholesterol, especially the LDL cholesterol, calcium, fibrin, inflammatory cells, and cellular debris builds up within the artery, and the term comes from Greek athero, means gruel or a wax, reflecting fatty deposits, and sclerosis means hardening. In the left side, you will appreciate it is a cross section of a blood vessel where there are 3 parts: the outer layer, the middle layer, and the inner layer. Okay. So in the inner layer, if the flowing blood contains cholesterol, this yellow is the cholesterol which gets deposits in each and every one of us, which begins at the age of 20 to 25. Actually, it is near the arch of aorta, atheroma it is called as, and we all are suffering at present from this atherosclerosis, but we should keep it in control. If the atherosclerosis progresses, let us see what happens ahead. Now, why atherosclerosis is important? This is also why this talk is important, because atherosclerosis is a leading global cause of illness and deaths, underlying most heart attacks, strokes, peripheral arterial disease, and kidney problems. Annual deaths in India are around 30 to 35% because of atherosclerosis. So my friends, almost 1/3 population is suffering from atherosclerosis and they lead to death. Population all suffers, but deaths are around 1/3. I will correct myself. Okay. Now this, we saw that it often begins in childhood and progresses slowly over decades. Autopsy study in the bodies have shown that there are fatty streaks in children as well as in young adults, and advanced plaques in people under the age of 40 years, especially, which is a risk factor in nowadays. I don't know, but let us appreciate if you can see the image properly. Now, this left-sided image is of a cross section of blood vessels. This is a normal section of our artery where it is called as tunica intima, inner layer, tunica media, and tunica externa. What happens if you come below the left side second figure? Cholesterol deposits as yellow fat inside the arteries. This process is going on because blood is flowing 24/7 in our arteries right from we have taken birth. Slowly, there are two possibilities because of this narrowing of these arteries. Sometimes there is a tear in the wall and the deposits are released, you can say. And sometimes because of this, there is clogging of RBCs and a clot is formed. So these complications, they go ahead and trouble us. In this figure, you will appreciate that kindly keep the cut section of the artery with this figure in your mind. This is a tunica externa, tunica media, and tunica intima. We'll be talking about tunica intima. Do keep this figure in your mind where we can see that there is deposition of these fat cells, then formation of foam cells. These things we should keep in mind. And let us go ahead what happens to this. See, now chronic inflammatory diseases are characterized by arterial plaque. Because of this deposition, there is inflammation in the arteries. This artery you will appreciate in the heart where the blocks are formed, and when totally it is closed, the patient gets attack and probably angiography, angioplasty, or CABG he's got. This is about the small arteries. Now, how it develops, we'll see in first. Endothelial injury begins due to high blood pressure. Because of this clogged, or we can say blocked arteries, the blood pressure goes on increasing. We get patients of hypertension with lipids, smoking, high cholesterol, even diabetes, inflammatory diseases, rheumatism, osteoarthritis. There are many inflammatory autoimmune inflammatory diseases. They all cause the entry problem. Here, the LDL particles, they get oxidized, and LDL are trapped beneath the endothelium, which triggers inflammations. They become formation of foam cells. I showed you in the previous slide the foam cells. And then the foam cells they are forming, they form some fatty streaks in the intima of the artery. So fatty layer is formed inside our artery along with the deposits. A fibrous capsule develops over the lipid core and a smooth muscle which migrates and secretes collagen. The plaque gradually increases and the arteries undergo remodeling. If the capsule ruptures, blood clots may be formed, potentially blocking the artery, and the entire key mechanism behind heart attacks and stroke is this only. I'll just show you a figure for your revision, if you can appreciate. See, this is a thin layer formed. These are the deposits. These are the LDL oxidation takes place over here because of recurrent deposit. And sometimes this thin layer gets ruptured, and the patient and this ruptured all material comes inside the artery where blood clot can be formed. If it is formed in the heart, it is a heart attack. If it is in the brain, it is a stroke. If it is in the limbs, it is peripheral arterial disease. So these are the problems. Okay. Just a minute. I'll make the screen big. Yeah. Is my screen getting shared properly?
Sir. Okay. Yes,
yeah.
sir, it is.
It is getting, no? Yeah. Okay. So this is rupture of a plaque, which I told you just now. I think everyone should appreciate why atherosclerosis causes blood clots and why and how the plaque gets formed and how it gets ruptured one day. Okay. Now, what are the symptoms and the complications we will see? In our mind, blood vessel is a big vessel, but friends, it can be a big vessel right from our brachial artery, carotid artery, but it can be small as good as less than 1 mm, which is in our brain also. Often asymptomatic, it remains for decades because of the early artery because it preserves the blood flow symptoms, and once they appear significant blockages, means once it gets blocked, the plaque ruptures depending or the artery is affected. In old age, the arteries become fragile, I will tell you, and becoming fragile, they break off easily, and even the plaques, they definitely get dislodged and they ruptures. The old age patients, we see many of these type of people. What are the effects of this ruptured plaque? In coronary arteries, patient may get chest pain, that is angina, shortness of breath, heart attacks. Carotid arteries, basically dizziness they can have. Speech problems, it is there in carotid arteries, and there is a risk of stroke. Even in peripheral arteries also, you can get claudications, pain while walking, cold and numb limbs, If this atherosclerosis develops in the arteries, there may be a renal function, altered, less blood flow leading to chronic kidney disease. Risk factors are many. There is a list of risk factors like high LDL levels, low HDL levels. Blood pressure, diabetes is very common after 40 years of age. Smoking, tobacco, obesity, unhealthy diet, and these are all modifiable things. No? We can advise our patients, and they can modify these things, which will definitely help to slow down the progression of atherosclerosis. For some cases, it is non-modifiable. What is it? Aging. We cannot modify our age because after 65, there are more chances of this atherosclerosis troubling to us. If there is family history, predisposition like genetic, if it is there, of hypercholesterolemia or lipoprotein A variants, these patients, in spite of taking all the modifiable care, the cholesterols are high because of the genetic problem. Ethnicity is also there. South Asian heritage has shown high risk in cholesterols. So some causes are modifiable, but some are not, and we have to accept that. Now, how to diagnose atherosclerosis? By age, we can say. In gender, usually it is both same, but in females, after menopause, it increases rapidly. That is a study shown. We can have blood test done where cholesterol, triglycerides, sugars, C-reactive protein for inflammations. They may suggest us about the inflammatory markers. In CT, coronary calcium score also show if the carotids, if the arteries of the heart are blocked or no. It can show us. If the coronaries get occluded, we can see it on CT angio. Yeah, Doppler ultrasounds or MRI or CT angiogram. That may also show for the brain. Functional test which we can do is a stress test and a ECG, which can shows in the heart if the blood circulation is less. Physical examination, auscultations for buoy, ankle brachial index. We were taught on in our internship days. See if probably you can call back or no. It detects the peripheral artery disease. This is a very easy test which can be done in the OPD. And even the patients appreciate that we diagnose them without any labs for peripheral arterial disease. Now, treatments and preventions, we will see. See, lifestyle and medical management. This is also important. Now, hearty, healthy diet. I think a dietitian should be there which should guide our patients. But in general, you can tell the patients to minimize saturated or trans fat and low sodium. That we should advise the patient. Increase the fruits in the diet, vegetables in the form of fiber, whole grains. They should also have in their diet, which will help down to reduce this. Exercise, people say daily, I don't have time for exercise. I get tired because of my all routine. But we should aim for a weekly exercise. This is a good plan for patient. You can suggest them that they can do 150 minutes of moderate walking and exercise in a week. Okay, if they are smokers, they should stop smoking. Weight management, blood pressure, cholesterol management should be done. In conventional treatments, there are medications like statins and lipid-lowering agents, antihypertensive, antidiabetics, antiplatelet therapy. This is the routine for our conventional way. I will not go in the details of that. What are the surgical procedures in an occluded artery? If it is in the heart, then angioplasty and stenting of the coronary arteries or a bypass can be done. That is a surgical intervention. In carotids, if it is there, because many times we see in carotid Dopplers that the carotid is 30% blocked, 100% blocked, where patients get symptoms of TIA, that is transient ischemic attacks. We can say, like in that cases, carotid and arteriectomy is also done for high-risk carotid plaques, because patients should not land up into stroke. If it is into the peripheral arteries, for critical limb ischemia or high scores, there can be a grafting done. This is by surgeons, not by us. If you can appreciate, here you can see a graft. I don't know whether in this figure is it appreciate. So this entire femoral artery is blocked. So there is a graft taken from here to here, and they have saved the limb. In summary, we can say that there is a plaque formation, then endothelial injury is there. Symptoms may vary, but like rupture of the plaque is there, leading to, we can say, like blood clots, as well as ischemia to the affected areas. These are the things. Now, what are the limitations of these conventional therapies? Almost all patients are taking conventional therapies. So there are limitations for this. I'll tell you. Conventional therapies manage the symptoms, but they don't address the underlying cause. Now, why should we consider homeopathy? That is also another question in mind. It is not because we are homeopaths, but surely homeopathy caters something. It is a holistic vital force approach where we individualize the patient and we give medications. So the accuracy is very much in homeopathy. Now, I will be going through a case discussion. I will request now the participants to type their answers in the chat. Okay. Now, a male aged 46 years was a known case of hypertension from 5 years and recently diagnosed with raised cholesterol came to my clinic for the following complaints. What were the complaints? He complained of a sprained feeling in the chest with discomfort in the chest from 1 week, which was more on talking and lying down. Whenever he talks or lies down, this discomfort in the chest increases. He was sitting quite silent during my case record reading and examination. But if I answer anything, he used to answer me very fastly and I can keep quiet. That was his observation. He also had an edematous swelling on his ankles as well as knees. The stools he complained of little hard stools, not too much. And like these complaints, he said that whenever this discomfort occurs, he sits in the fan and he gets relieved for a temporary period. So from this case, what can we say? What is the patient suffering from? Can anybody tell you what happens? Looking at these complaints, we can say the diagnosis was angina pectoris. Because of raised cholesterol and blood pressure, patient was having this intermittent pain in the chest. Clinically, this is called as angina. Okay. Now, you can say before the treatments, kindly go through the lipid profile levels. On looking at it, it showed that the triglycerides were 659. Because of the patient's privacy, I have hidden the name as well as some data because the patient should not be exposed to everybody. And if you go down, total cholesterol was 232 and like HDL was low, that is 29. So this patient had hypertension with hyperlipidemia. So surely he is a candidate of atherosclerosis and his heart is affected because of this. These were before my homeopathic treatment. Conventional treatments were going on, but he was not responding for that. After treatment, you will see the same patient, like it came down to 387. Normally, it should be up to 150, but from 650, we have come down to 387. So it was a significant improvement in like his reports. Even the HDL cholesterol, which was low, it is still low slightly, but it was corrected and it came to 34. That is there. And like LDL cholesterol, direct was 7.46. So we can say he was on the recurring phase. So with addition of homeopathic medicines, see how the lipid levels have come down, even though he was not responding to the conventional treatments. This was a reportization table. I told you the complaints which the patient told us. Now in these complaints, like I'm an old user of Radar. I'm very happy for it. So in the synthesis treasure edition, I have worked this. The following rubrics I considered from his complaints narrated to me. What was the complaints? Like generalities, pain, sprained as if. Now here in this repertory, there is a very good thing that a clinical rubric is also there. That circulation complaints of blood when he was lying down. He told it was more on lying down and talking. So we can go in generalities, circulation. We have got rubric for that. Complaints of blood by talking on. He told me that he just lies down with his eyes closed, so he was better by ameliorated by closing his eyes was an addition to this, but it was not significant to me. The joint swellings were edematous, so we took extremity swelling edematous on the joints. In the mind section, like he answers very hastily, so like I took the rubric as mind answering hastily. That way he was proceeding very quiet, so mind there was a quiet disposition was a quiet. Okay, quiet disposition we took. And what happens, like whenever he used to have the chest pain, he used to rub it or he used to do some efforts to relieve it. So the 8th rubric was taken, ameliorations to be magnetized. And he had a hard stool, so this was a concomitant rubric I have taken, like abdomen constipation type of stools for hard. On repertorizing in the RadarOpus, we found that there were all medicines on the right side. But leading remedies here for 12 marks was Bryonia. Calcarea was also there. Lycopodium was the 3. But the third remedy was selected. We will see why this third remedy was selected. Okay, kindly keep this repertorization table in your mind. This also we will see that before, like at beginning our treatment, this was his ECG, where he has taken in a routine checkup along with the conventional treatment. If you can appreciate, lead V2, V3, there is a ST segment depression over here. This is also over here. So it shows a lateral and a septal wall ischemia of the heart. This was before treatment. Now, after I was on regular conventional all treatments, but the same thing was remaining for 1 year. Once we introduced our homeopathic medicines, after some days, when the ECG was taken of him by a cardiologist as a routine checkup, Just see the improvement which they found. You can see V1, V2, and V3. The ST segments are as good as normal. If you can appreciate, you can see these ST segments. Even the cardiologist was surprised to see that how this has improved, because ischemia usually doesn't improve by conventional way. So like this was a good result which we obtained. This ECG was taken by the cardiologist as a routine checkup of the patient. Okay. Now the remedy selected, which we saw just now, lycopodium. Now why this remedy was selected, we will see. Because on the following points, there was edematous swelling of the joints that covers lycopodium. Pain and blood vessels were complaints which are modality showed it was more on talking and lying down. Hard stools, but not significant, but they were there. Sprain filling in the back. He answers hastily. He was quiet in nature. And the myasm considered here was psychosis. So lycopodium 200 TDS we gave him for 4 days for his chest discomfort and sprain pattern. And after that, I asked him to repeat the doses SOS whenever he gets this symptoms. But in 5 to 6 days, the pains are almost 80% better. His all pains went away in 5 to 6 days. He only required to repeat the doses in 3 months once or twice. He did not take anything. Lipids also have settled down from almost to half levels. ECG showed normal. So this was a good thing which homeopathy can offer him, because it only not only covers the underlying pathology, but it helps the patient to restore the organ circulation also. So that was very appreciated. Now, I will be going to the case 2. I think everyone should appreciate this case. A female patient who was having diabetes and hypertension for 8 to 10 years complained of sudden onset chest discomfort from morning. The age here mentioned I had forgotten, but she was around 52 years old. From morning, she came to the OPD with these complaints. She had sudden spasmodic cough, which was dry in nature. Suddenly, it had started in the morning. And because of coughing, she had some sweating episodes which were profuse, but they made her feel weak. And she was looking very anxious about the sudden complaints, because she said, like yesterday night till I was comfortable. From today morning, this cough has started. Palpitations I'm getting. I'm feeling very weak. So she had come to the OPD along with the relatives. On examination, the pulse was like 56. It was recorded. She was on conventional treatments ongoing also. Her blood pressure recorded was 96 by 64, which was a little bit less. Body temperature was 94 degrees Fahrenheit. Obviously, because she had sweated a lot, so the temperature was little less. So it is called as a little bit hypothermia. Her random sugars were high. That means 320 milligrams. Now, what to do? What to do when a such patient comes to our OPD? We should do nothing, but we should admit the patient with primary medications. Friends, this is very important. All the time, our symptoms should not we should not be busy. We should not match the following of symptoms as well as the symptoms of medica and give the medicines. The patient was known diabetic. She was having like low BP, so profuse sweating. Also, her sugars were high. We should admit such patients. That is very important. Why? To save us from medico-legal problems. I work as a medico-legal advisor. So usually I keep this thing in mind. You should also keep these things in mind. But only on the present state, I gave her doses of 𝐈𝐭'𝐬 30 in collapse conditions, which we give 30 minutes every 30 minutes till she reached the hospital. Because our duty is to refer the patient and admit him. But in the meanwhile, we cannot say we are homeopaths. We should make an effort to save the life. So I gave her these doses. Okay. Now on admission, like these investigations were done. If you can appreciate the left side ECG, AVR, AVL, and AVF. Okay. Like here, if you see lead 2, lead 3, and you can see AVF. The ST segment elevation was there. The hospital people found out this. Lead 3, lead 2, and this is AVF. This patient, the hospital cardiologist diagnosed as a inferior wall infraction. So it was a good thing that we admitted her, because only giving symptoms like cough, sweating, and giving 𝐈𝐭'𝐬 would have not helped her. She would have probably ended up into a serious trouble. So we admitted her. It was a good decision. And this diagnosis was done by the cardiologist. Further, they did the angiography of the patient, where this vessel they found to be narrowed. And this is the left coronary artery. At the distally, it is showing narrowing. And further, she required a stenting. This was not my job. It was a job of a cardiologist. But the main thing to tell you all is we admitted her in proper time. That is very important, looking at the atherosclerotic condition. Now, On the second day only, when I visited her as a doctor, after carbohydrate, I started her this medicine. Like in a repatriation with radar, we took the presenting complaints, even though she was admitted, heart pain, neuralgic like angina that we know. Then she was quite anxious because of these pains. So we took that the pains of chest pain, wetting, and anxiety. Concomitants, like, we took that as she was sweating in the section of sweat, concomitants, chest pain in general, we took from radar. And from respiratory system, cough, we took type as dry, hard, rattling, and hacking. The remedy which all covered this was like spongia. Arsenic was leading, but she never told that she was feeling chilly and she was like, restless, nothing like that. She was anxious, not restless. So I started her with spongia, and this spongia helped her for her cough and for her rapid recovery. Now, friends, these are the two cases which I was going to tell you, and like I explained you, one should think of admission where necessary. One should not keep playing with the patient's health. Now, in atherosclerosis, a question comes to the mind: what rubric should we take when the patient comes to us with atherosclerosis? Different repertories have mentioned different rubrics. Some rubrics I will just tell you for today. There is a repertory of hypertension, where we get a rubric as atherosclerosis with somebody is having like hypertension, remedies as Aurumbet, Ravalfia, strontium carb, these are the remedies. Synthesis repertory also gives some repertories. In the chest section, it gives us a direct rubric of atherosclerosis of coronaries, where arsenic iode, aurum, barata, cactus, and triticus are mentioned. In generalities also, it gives arteriosclerosis, ossification, and degeneration. So according to the pathology, we should think the repertory synthesis directly gives us the rubric like aurum, barata carb, sickle, variola, and vanadium as the remedies. Robin Murphy also states the rubric as atherosclerosis, his repertory, where these remedies like arsenic iode, then calcarea, chlorine are given. Atheroma, this is a good rubric where you get only Murphy's repertory, atheroma. So in all these atheroma further develops all the complications. So we get the remedies like aurum mur, belladonna, calcarea, plumum, silicia, and sulfur. Pathak's repertory. This repertory is one of the good repertories which I have found. It is a clinical repertory. It gives you a rubric of arteriosclerosis. Only one remedy is mentioned, that is Sumbul for the heart. Like this is one of the good repertories. Or one of our respected Dr. Bagal, like sir, last time he had a lecture. Sir has a very good grip over Pathak's repertory, and he has explained us very nice rubrics from Pathak's repertory. So for immediate reference on our table, the repertory is very useful. It directly gives you the rubric. Borak repertory also gives you like atheroma of the arteries. It shows like aurum, phosphorus, like strontium carb, vanadium, and sumbul. Kent's repertory also gives us lots of remedies like natrum iode, strontium iode. So these are the different clinical rubrics given in different repertories. I'll take a quick overview now. What is the quick overview? When a homeopath takes a miasmatic approach to atherosclerosis, a homeopath should take this approach. There aren't like interpretation of the underlying chronic disposition, like the patient's terrarium, like using Hahnemannian classic and triad or persistent miasms. Atherosclerosis and related dyslipidemia and blood pressure are commonly mapped as a combination of psoriasis, psychosis, and syphilis. This we should keep in mind, that miasmatic approach is also important. Only a rubric of atherosclerosis or atheroma is not going to help us. Now, miasms, what we should consider now. Suppose, like we can say, a patient is having high cholesterol, and like we can think of a psychotic miasm. What in this miasm we see that there is overgrowth in the arteries, where there is lipid deposition and calcification. LDL excess is there, which causes smooth muscle proliferation. We saw fatty leaflet formation because of the foam cells, and there is thickening of the arterial walls. If it is associated with varicose veins, overgrowth, ossification, and pseudosoric tendencies, then we should consider the miasm as a psychosis in our case. Now, syphilitic miasm also comes in all atherosclerosis cases, where there is a rupture of the plaque, or where there is tissue background, or there is loss of elasticity, and which leads to structural deterioration like arterial stiffening, fibrinoid necrosis, reduced elasticity of the blood vessels. Then common in faith of hypertension complications like malignant hypertension. This is called as a secondary hypertension. Or that time also syphilitic miasm comes. Left ventricular hypertrophy and retinopathy, where there is a bleeding in the retina or there are clots on the retina. So in such cases, we should think of syphilis. Case study on hypertension sites show that syphilitic incidences leads to widespread of destructive changes, fibrinoid necrosis of the vascular wall, and left ventricular hypertrophy. We have many patients with LVH. They are only on diuretics and anticoagulants, but this miasm should be thought of. SORA. The SORA miasm comes in this? Yes, it comes as a constitutional predisposition. Like where there is a functional disorder in the patient, often superficial or any superficial manifestation like headaches, anxieties, dysbiosis, obesity, but deep structures are not involved. Foundation of nearly all the miasms and are the integral, they should be an integral part of his totality. You should keep this in mind. Now we should apply these miasmatic insights into our practice. This is very important. Whenever a case comes to us, like of any atherosclerosis, having blood pressure, hypertension, hyperlipidemia, these are very common in all these things. Begin your case with a reporterization, and it should contain as atherosclerosis of the arteries. Now, usually when we treat many patients of atherosclerosis, there are some key remedies which are included, like arsenic iode, aurum metallicum, cactus, baratacarum, calcarea fluor, cuprum metallicum, and strontium powder. But note, calcarea fluor and aurum met are classically the antipsychotic and antisyphilitic remedies. They should never be given to the psoriatic patients because they will work, but they will work for only short time. These are very deep acting remedies, so we should keep them reserved for psychotic and syphilitic miasms. Always apply miasms to all these patients. Miasmatic insight will little bit continue. We should identify the dominant miasm through symptoms. Now, the presenting complaints when the patient comes, we should identify the miasm. What are the psychosis signals that we should see while taking a case? Look, we should have a family history where there is obesity, if there is human papillomavirus warts, if it is there in the family, constipation is there, then it is a psychotic tendency. Yeah, we saw in the lycopodium case where we saw a psychotic tendency. And constipation was also a concomitant. Physically, we can see that there is a poor inflammatory clearance, pitting edema, thickened vessels. These also are the things where we can think of psychosis. Mental and emotional level, we can see if somebody is jealous, somebody has fixed and suspiciousness in their mind. This is a psychotic tendency. So this miasm insight should be kept in mind. Now, some signals we get in a case where there is a syphilitic signal. Early onset arterial calcifications like jerky or rheumatic pains, dramatic weight loss, where a patient says in 3 months I have lost for 10 kg, family history of diabetes. Early cataracts. What are early cataracts? That is below 35 years of age. Little emotional disturbances despite of life-threatening pathologies. In small problems, patient immediately gets disturbed emotionally very well. Anxiety, panic attacks. Suppose they have recurring ulcers, like mouth ulcers, simple. People treat it only with B-complex and in homeopathy treat with borax. That is my observation. But if they have recurring ulcers, gangrene in the past, suppression, anyone in their family, indicates destructive miasm precipitating atherosclerosis. So in such cases, we should always keep in the underlying miasm as a syphilitic signal. And the remedy which our reputation pops up, we should think for syphilitic remedy which will act much better than the structural or mechanical totality. There should be a layered prescribing approach also in atherosclerosis. So the first prescription which comes, whenever a case comes to us, there should be, if there is a psoriatic tendency, a constitutional remedy which is based on the totality, it should be there. So this should be your first prescription. If the patient is not having any serious problems, your first prescription should be a constitutional remedy and wait and watch. That should be there. Now, after a follow-up of the treatment, like 6 to 8 weeks, you should keep in mind that there is a Herring's law of cure is seen or not. If it is not seen, your remedy is not working properly or it is selected wrongly. You should retake the case. Also, after 6 to 8 weeks, you should recheck the cholesterol. If the levels are dropping down, this is a sign of improvement. Blood pressure examination should be there. If the blood pressure is reducing gradually, systolic or diastolic, along with the treatments, it shows that the patient is settling down. So there is now functional disturbances are coming down that you should keep in mind. Now, when all things come down, what is the second prescription? It is a very big topic. We can have a separate lecture for that. Second prescription usually is anti-miasmatic remedy for atherosclerosis patients. And usually from psoriasis to psychotic and syphilitic patterns. Like in such cases, we should think for these two miasms, and that should be our second prescription. If they do not shift, our prescription should be hold on by giving placebo. That is very important. We should not hurriedly follow first and second prescription rules. Now, cautions and considerations for a homeopath. This is very important because like after passing, we have got a sword in our hand. Like we can give any remedy to anyone because we are the doctors of this pathy. But we should bear some cautions in the mind. What are they? See, homeopathic miasms are theoretical. Keep in mind, they are not substitute for standard cardiovascular evaluation. You should not see that they are substitute for cardiologist. Repertorization is a must and it always has to be done for individualizing the patient. Do not label a patient syphilitic simply because he has atherosclerosis. I've seen many students, they say syphilitic miasm because he's having atherosclerosis. No, you should have proper reasoning for it. You should know what are the functions, what are symptoms, which miasm is dominating, which miasm is covering this. So syphilitic should not be routinely used. That is a caution because you will end up into giving anti-syphilitic remedy which the patient doesn't require at that state. Now monitor conventional labs. This is very important because even the symptoms, if they come down, the lab value should also come down. This is a sign of improvement where LDL, carotid Doppler, pulse wave velocity, and you should keep an observation on these lab reports which are settling down. They must settle down if your medicines are working properly. You can opt out for mother tinctures in emergencies. A question comes that should we use mother tinctures or no? I myself have not used mother tinctures, but books have mentioned it that you can use mother tinctures in emergencies. You can use Aurumbate 3x or Cactus 30C if there is a severe angina. Use sparingly these mother tinctures to avoid the confusion in case progression. Because many times, there is suppression of symptoms and a case progression also we don't know that the case is progressing. Because of suppression, we get misguided by using mother tinctures and we feel that the patient is stable. But how many days? 1 month, 2 months, 3 months, one day he will complicate. So we should keep this thing in mind. Yeah. Now, what is the key takeaway? This is for all of you. From this all talk, see, atherosclerosis is a slow. It is a silent process that gradually stiffens and narrows the arteries. We have seen in each and every individual it is there, which limits the blood flow. Over time, this can lead to serious cardiovascular events. But early detection and intervention, especially lifestyle changes, medical treatments can dramatically slow down or progress its progression, allowing many people to live long life and active lives. See, our grandparents lived a life of 80 to 100 years. Nowadays, we see 60 to 80 years. We consider that they are now our grandparents. Definitely they are there, but they have aged now. Because of the, good lifestyle, these people had very good life to live with for many years. I think we should also practice and promote our patients for that. So this is a takeaway. Along with medications, we are going to stay, but not forever. Now, ethical and practical notes I will tell you. Now, this plan is meant to complement this all plan which I told you to treat the atherosclerosis patient. This should be complementary and it is not a replace for medical treatment. Or coordinate always with patient cardiologist or endocrinologist. Always we should be in coordinate. This is a common question asked to us. Sir, I am taking homeopathy now. Should I close down my all allopathic medications? Should I leave my diabetic medications? Should I start my conventional hypertension medicines? In such cases, we should be feel free to coordinate with a cardiologist, a physician, or an endocrinologist if somebody is having thyroid with other problems or any like endocrine disorder. Do not feel inferior. Clinically, we should be prepared to talk to all the specialties who stand as a board of homeopaths. Also, avoid overuse of mother tinctures. Prefer LM potencies with high sensitivity or deep acting states. If there are some deep acting remedies, think of LM potencies. We should not immediately, even though if the remedy is proved to be strong, looking at the susceptibility of the patient, this remedy will not harm the patient. So we should think for long-term use. Miasmatic hierarchy is a clinical lens. Observe the totality and the unique keynotes. Only do not think on pathology. Because if you think on pathology, the prescriptions are partially going to help the patient, not totally. Like, my juniors, they open a boric, they say remedies for diabetes, remedies for hypertension, remedies for asthma. 30 remedies are given. Out of them, 20 to 25 or polycrest remedies are there. Then the battle in their mind is there. This is chilly, this is hot, this is thirsty, this is thirstless, this is weeping, this is the introvert. We should not do that. You should see the unique keynote symptoms of the patient and then think of the remedies. So these are the key takeaways for you from my 33 years of experience. I'll be going for summary. See, atherosclerosis, it's primarily a psychotic, miasm involved, where there is a lipid overgrowth and calcification with syphilitic aspects when there is a degeneration and collapse of the arteries occur. When there is a rupture of the plaque, then the artery gets ruptured inside and it collapses down because the pressure inside the arteries drop, and because of this dropping, syphilitic complications start in the body of the patient. Psora is rarely visible in atheroma, but fuels up the susceptibility and cyclical reactivation. So direct psoric patients we do not see in our advanced atherosclerosis patients. They are initially there, but the miasm gets changed. But surely they add up to the fire as a fuel. So basically they are all psoric in nature, which has added, and then the patient has progressed. Now, by tracking the dominant layer of the miasm expression, you can tailor a remedy strategy in a fusion of repertory, clinical totality, and Herring's law to support a holistic recovery. So, like, you should see layer by layer from the miasms if the patient is improving or if he is worsening also. So, being a homeopath, you should keep it in mind. So, friend, I think I'm at the end of this lecture. I've kept some 5-10 minutes for question and answers. This is my communication address. Like, if anyone feels for any queries, kindly you can communicate to me on email. Also, you can see my YouTube channel, Dr. Bhavdekkar's Homeopathy, where a number of videos are loaded in local language here in Marathi, and captions are also there. So, friends, I thank the RadarOpus and BGN team for giving me this opportunity, and I'm very happy to all of you for being participants. Hope in future I get again an opportunity and we all meet again. Thank you. Can I hand over this mic for question and answers?
Sure, sir. Thank you, sir. Thank you so much. It was a very interesting session, very knowledgeable session it was. We can see nowadays homeopathy is curing the disease like atherosclerosis. So it's too good for us as a homeopath. Like, we can say the things with the confidence, like homeopathy is curing such kind of diseases.
Yeah.
And in today's session, I like those cautions and all. As a doctor, we should take those cautions. And the takeaway, that was also too good. So
Very
overall, the presentation was too good. Too knowledgeable presentation it was. We have learned many new things in it. To you. And thank you to all our attendees for listening the session so patiently.